Good morning, and welcome to today's webinar, an overview of safety and health hazards in veterinary clinics and hospitals. My name is Brian Brocker. I'm a safety and health consultant with the Pennsylvania OSHA Consultation Program. The purpose of today's webinar is to provide an overview of safety and health hazards in veterinary clinics and hospitals. The chat will be open during the webinar. If you have questions, please submit them through the chat feature. If due to technical nature of the question and a more thorough response is required, we'll post the answer on our website within 7 days of the webinar. The webinar itself will be posted there as well for future review. In most cases, the top safety concern is animal handling, restraint, and bite prevention. You should be able to differentiate from typical animal behavior and expected adverse behavior. You want to ask yourself, does the animal hide or attack when approached by strangers? Does it react in fear from quick movements? Animals hear higher frequencies than humans and may react to something they are sensing of which we are unaware. They have better night vision, so they may react to something we do not see. Typical causes of aggression. If they're injured or in pain, may it be from injections, treatment of wounds, or even examinations. If they're nervous or apprehensive, if they are protecting their young, if they're protecting their territory or owner. If they are fearful, animals will attempt to keep a stranger away when it feels it cannot avoid the situation. When addressing aggressive behavior, develop a policy or program to protect employees, clients, and animals. You want to create a patient history which requires proper record keeping and review with appropriate warnings of past aggression, which are prominently displayed in the charts. You want to make observations to observe the animals when they're entering, keeping in mind the body language, the sex, if both sexes are present, and whether they are intact, and restraints being used. Continuing with addressing aggressive behavior, based on history and observation and comfort level of those handling the animal, you may need to seek assistance. You want to have a restraint program where you want to identify the types of restraints being used and the need for different restraints as needed. The program should consist of regular inspections, daily checks to just make sure they're intact and working properly, then more thorough monthly, quarterly, etc. inspections, which should be maintained with records. The removal or repair of devices that are defective is necessary so that somebody doesn't accidentally use one that breaks. Proper storage and location. Always keep them where they're supposed to be. And you should always maintain the manuals as long as the device is in use. You want to provide training on animal restraint and bite prevention. This training should include an understanding of animal behavior, how to identify the hazards, proper restraint devices, their use and the locations, chemical restraint options and their proper administration, loss or accident histories, first aid procedures, and record keeping. One of the major health concerns is biological hazards, and maybe the primary one being allergens. Animal-related asthma and allergies are exaggerated reactions of the body's immune system to animal proteins. Sources include animal dander, scales, fur, body waste, and saliva. Handlers should perform manipulations within ventilated hoods or safety cabinets when at all possible. Handlers should also avoid wearing street clothes. They should leave their work clothes at the workplace. Keep cages and animal areas clean. Reduce skin contact with animal products such as dander, serum, or urine by using gloves, lab coats, and approved particulate respirators with face shields. Employers should modify ventilation and filtration systems, such as increasing ventilation rate and humidity in animal housing areas. Ventilate animal housing and handling areas separate from the rest of the facility. Direct airflow away from workers and towards the back of the animal cages, rooms, or kennels. Install ventilated animal cages, racks, or filter top animal cages, such as that in the picture above. First should also decrease animal density, that is, the number of animals per cubic meter of room volume, where at all possible. You want to keep cages and in animals areas clean. Use absorbent pads for bedding. If these are not available, use corn cob bedding rather than sawdust bedding where possible. You want to provide PPE or personal protective equipment for animal handlers. For example, you have gloves, lab coats, approved particulate respirators. I guess lab coats, you could also include smocks in that, and face shields. Should also provide training about animal allergies and steps for risk reduction. Provide health monitoring and appropriate counseling and medical follow-up for workers who have become sensitized or have developed allergy symptoms. Another major health hazard concern is zoonosis. These are infectious diseases that spread from animal to humans. They do this through aerosols, which are through breathing, droplet spray, ingestion or oral, direct contact, indirect contact, and vector-borne. Approximately 60% of the more than 1,400 human pathogens are zoonotic. About 75% of emerging pathogens are zoonotic. So it's a rising concern and becoming more and more prevalent in the industry. Here's an example of zoonosis reported in veterinary personnel. This is a wide list of them, including salmonellosis, MRSA, anthrax, avian flu, TB, rabies, the whole list of them there. We're not going to go through all of them, but there's examples of what you need to be aware of and to protect employees. Exposure sources obviously are animals, their body fluids, tools, surfaces, and other objects in the environment. Prevention controls for biological hazards. Primary source is hygiene. Basic general hygiene is washing hands, of course, before eating, drinking, or smoking, after the use of restrooms, after cleaning animal cages or animal care areas. Whenever the hands are visibly soiled, and before and after each patient encounter, and after contact with anything such as feces, blood, body fluids, excretions, secretions, exudates. Liquid hand sanitizers may be used if hands are not visibly soiled, but hand washing with soap and water is still preferred. You want to keep your fingernails short, prevent materials, germs from getting underneath them. You want to avoid nails or hand jewelry, artificial nails or hand jewelry when handling animals. Again, same reason, you get materials on those devices and it can cause problems. Hand washing supplies should always be well stocked at all times. PPE or personal protective equipment, such as gloves and sleeves, should be worn when touching feces, blood, body fluids, secretions, exudates, and intact skin. For specific procedures, we look at general clinical procedures. You want to wear outerwear and gloves for all procedures especially with potentially infectious animals, and performing soft tissue aspirations. For dental procedures, you want to wear outerwear, gloves, facial protection, within the range of splashes or sprays. So anybody close up should have that. Resuscitation, you want to wear gloves and facial protection. For obstetric procedures, wear gloves and shoulder-length sleeves, facial protection, and impermeable outerwear. For cropsy, wear cut-resistant gloves, facial protection, and impermeable outerwear. For diagnostics or specimen handling, protective outerwear and gloves is sufficient. Some procedural precautions. First things first is at the intake or reception area, you want to look for aggressive, potentially infectious animals. Considering when this occurs, you want to have either altered entrance, use carrier cages or gurneys, or direct entry into exam rooms. Similar precautions should be taken in large animal and equine facilities. Needle stick injury prevention. We will hit on this later as it applies to bloodborne pathogens, which applies to human exposures, which we will talk about later. However, common sense application applies to animal handling as well. Do not recap needles. There are rare exceptions for required medical procedures or protocol, but typically do not recap. Do not remove an uncapped needle from the syringe by hand or place the needle cap in the mouth. Dispose of sharps in designated containers and replace sharps containers before they're full. When isolate infectious animals, the isolation you want to isolate animals with contagious zoonotic diseases as soon as possible. You want to label the cage, stall, or kennel with patient's status and precautions. Keep only the required equipment for care and treatment of patient in the isolation room, including dedicated cleaning supplies. Disassemble, clean, and disinfect equipment removed from the isolation area. Isolation infectious animals includes discarding the gloves after use. You want to leave other personal protective equipment, for example, gowns or masks, in the isolation room for reuse if it is not contaminated. You want to clean, disinfect, or discard protective equipment between patients and whenever contaminated by blood or body fluids. You want to place potentially contaminated materials in a bag before removal from the isolation room. Use a disinfectant foot bath before entering and leaving isolation room or kennel, such as the picture. You step on it, decontaminates going in, step on the way out, decontaminates on the way out. You want to limit access into isolation rooms. Only authorized personnel should be in there. Keep a sign and logs for all people having contact with animals in isolation. And you want to monitor air pressure daily while the room is in use. When dealing with laundry, wear gloves when handling sold laundry. Wash animal bedding and other laundry with standard laundry detergent and machine dry. Use separate storage and transport bins for clean and dirty laundry. Not a bad idea to label them as well. You want to follow state, federal, and local regulations for proper disposal. You want to typically use biohazard bags, sharps containers, and approved pickup containers. This also you'll see addressed in the bloodborne pathogen standard. For rodent and vector control, you want to seal entry portals, eliminate clutter and sources of standing water, keep animal food in closed metal or thick plastic covered containers, dispose of food waste properly to keep the facility free of rodents, mosquitoes, and other insects. When cleaning and disinfecting equipment and environmental surfaces, clean the surfaces and equipment to remove organic matter. Use appropriate disinfectant according to manufacturer's instructions. You want to mist with water or disinfectant to minimize dust and aerosol exposure. You want to clean and disinfect animal cages, toys, food, and water bowls between uses and whenever visibly soiled. Clean litter boxes once daily. Wear gloves when cleaning and wash hands afterwards. Decontamination or spill control response. Immediately spray a spill or splash of blood, feces, or other potentially infectious substances with disinfectant and contain it with absorbent material such as paper towel, sawdust, cat litter. Wear gloves, mask, and other protective clothing, including shoe covers if the spill is large and you may step in it. Restrict entry to the area. Seal gathered up material in a leak-proof plastic bag and clean and disinfect the area. Other environmental controls include designated areas for eating, drinking, smoking, application of makeup, and similar activities. Forbid these activities in animal care areas or in laboratory area. Do not keep food or drink or for human consumption in the same refrigerator as food for animals, biologics, or laboratory specimens. Dishes for human use should be clean and stored away from animal care and animal food preparation areas. Hazard communication. This is an OSHA regulation developed, which we have other training that goes into much more detail. Again, this is just an overview, but the hazard communication standard was written to protect employees and make them aware of the hazards of chemicals in the work area. The standard requires a written program that must at least describe how labels and other formal warnings, safety data sheets, and employee information and training will be met. The written program must also include a list of hazards, which are hazardous chemicals, which are known to be present in using a product identifier, such as referenced in the appropriate safety data sheet. Product name is a good example. The methods the employer will use to inform employees of the hazards of non-routine tasks and the hazards associated with chemicals contained in unlabeled pipes in the work area. When other employers are working on your site, you must provide access to SDSs and provide cautionary measures, in-house labeling, and they must do the same for you with chemicals they bring on site. Primary container labeling. This is products you're purchasing. A manufacturer or supplier is required to make sure these labels are on all containers that you purchase. They must include symbols called pictograms. You can see in the upper right-hand corner, which we'll go over in a second. Should also have signal words, hazard statements, precautionary statements, product identification, supplier or manufacturer identification. I mentioned pictograms. There are 9 pictograms covering health and physical hazards and environmental hazards. Excuse me. Going from left to right, you have the exclamation point, which indicates an acute toxicity, typically less severe, such as irritants and sensitizers. The next one shows a person with a starburst on the chest. This indicates respiratory hazards, carcinogens, reproductive hazards, and mutagens. The skull and crossbones indicates an acute toxicity, such as a poison. The beeper dumping onto a hand or steel bar indicates corrosive to the skin and eyes and could cause damage. It's also corrosive to metals. The floating fish and dead tree indicates an environmental or aquatic hazard. This one is not required under OSHA as they do not cover environmental issues, but you often see that on SDSs. The next one is an exploding bomb, which indicates an explosive, self-reactive or organic peroxides. The flame indicates that it's flammable. The flame over top the letter O indicates it's an oxidizer. A compressed gas cylinder indicates gas under pressure. Again, that's a quick overview. Often you have to take out of, let's say, a 5-gallon container, you're going to take it and put it in 8-ounce, 16-ounce bottle spray bottles. That secondary container also must be labeled. This and the product must contain a product identifier and words, pictures, symbols, or combination which provides the same basic information as the original relating to the hazards. You can use the same information on the primary container labeling or any other labeling meeting these requirements, such as HMIS, NFPA, and other labels with minimum information. You can see at the bottom those labels. If you use those labels, employees must understand what each of those categories mean and what the numbers system means on them, just like with the primary containers. Safety data sheets provide detailed information on hazards of product and required to have 16 sections listed below. I'm not going to go over all those sections. Again, that's another training that we have, hazard communication training all by itself. The chemical manufacturer importer is required to obtain or develop SDSs for each hazardous chemical they produce or import. Employers must have SDSs in the workplace for each hazardous chemical they use. So you make sure these are available to employees. Usually keep a booklet, keep them online, so all employees know how to access them. Before employees are required to work with chemicals in the workplace, they must be trained on the hazard communication standard itself, why there's a standard, what it's in place for, hazardous chemicals in the workplace, and specific operations they're used, the location of the written plan, labels and safety data sheets, the meaning of pictograms, signal words, precautionary statements, the SDS format, physical and health hazards in the work area, how to detect presence or release of hazardous chemicals, steps taken to prevent or reduce exposures, how employees can protect themselves from exposures to these hazardous chemicals, example, engineering controls, work practices, PPE, an explanation of special labeling in the workplace, and emergency procedures. Anesthetics in the waste pose health effects to those using or exposed to them. Excuse me. Acute effects include drowsiness, irritability, depression, headache, dizziness, and nausea, as well as problems with coordination, audiovisual ability, and judgment. Chronic effects include liver and kidney disease and adverse reproductive effects, increased risk of miscarriage, birth defects, and potential cancer. Here's a list of anesthetics you may find in veterinary clinic or hospital. You see such things as nitrous oxide, isoflurane, pantherine, to name a few. We're not going to go over each of these, but we kind of generalize them below. What are the causes of waste anesthetic gas exposures? One occurs when you're during surgery, when you're repositioning the patient during procedures. You can see from this graph on here, it's from a California study where isoflurane was being used. There's a spike when the patient is being turned or repositioned. You do this enough and you could be overexposed for an 8-hour shift. See, typically it's below the 2 parts per million, but when you roll them, it goes way up. So if you do that enough, you could be overexposed. Another potential exposure source is from the edges of the patient's mask or around the endotracheal cuff. Other causes include during hookup and disconnect of the system while gas is still on, from leaks in the breathing circuit if the connectors, tubing, and valves are not maintained and tightly connected, or dry rotted could be an example as well. When patients are exhaling during recovery from anesthesia. When opening the induction box, when refilling the vaporizer, when cleaning up spills. Large spills can cause overexposure. Personnel without respiratory protection should be evacuated from a room with a spill. What are some controls? We start with engineering controls. Effective anesthetic gas scavenging system that remove excess anesthetic gas at the point of origin. A non-recirculating ventilation system can reduce waste gas levels in this area. Effective HVAC systems and/or general dilution ventilation. Adsorbers filled with activated charcoal can also trap most excess anesthetic gases. You want to use a key-filled adapter when refilling the vaporizer to prevent spills. You can see jar with it on, and there's the actual adapter. Work practices include visual inspection of all anesthesia delivery components, reservoir bags, tubing, etc. Leak tests prior to each use of the anesthesia machine. You want to weigh charcoal canisters daily and cap it during storage and disposal. Use the lowest anesthetic gas flow rate possible. And when you do your, I think I talk about it later, but when you do your leak checks there, you should keep records of all this. You want to turn off anesthetic gas flow before disconnecting patient during the procedure, for example, when repositioning the patient. You want to eliminate residual anesthesia by flushing the system with oxygen, including the breathing bag, before disconnecting the patient from the breathing system. Minimize use of face mask and induction boxes. Use properly inflated endotracheal cuffs to create a sealed airway. Don't use smell test for assessing flow of gas. You want to follow proper maintenance of equipment to prevent leaks that include taking airflow measurements of ventilation, calibrate and ensure preventive maintenance is conducted on an anesthesia machine, including leak detection of scavenging gas systems and breathing circuits. Keep and maintain records of the anesthesia machine and leak detection test. I did mention that earlier. Other work practices include periodic personal exposure and environmental monitoring to determine the effectiveness of the overall waste anesthetic gas control program, short and long term. Use proper PPE such as gloves, goggles, face shields, chemical protective clothing, which are recommended to ensure worker protection. Respirators where needed. And of course, employee training. What about drugs and narcotics? These can have effects on those handling them. Here are some examples. Angioplastic is an animal cancer treatment. There are chemicals affecting pregnant or to-be pregnant persons. Mycotil 300 is an antibiotic that causes illness or death if injected or puncture wound or contact with skin or mucous membrane. Chloramphenicol is aplastic anemia in humans. These are just a few that I pulled out to show you that what can the worker be exposed to when using these materials. Controls include, and you'll see this redundantly as you have already, the Hazard Communication Standard, which covers labels, SDSs, and training. PPE, such as chemotherapy gloves, non-permeable gowns, respiratory protection, underpads and containment devices, eye and face protection for splashes, shoe covers, and spill kits. You want to have warning signs of hazardous drugs for pregnant, breastfeeding, or reproductive effects. In your receiving and storage area, you want to inventory what's coming in and what's going out. Ensure you track usages and ensure proper storage, such as ventilated cabinets and separation. You want to limit access, no unauthorized entry into storage areas or area of use. Again, hygiene plays an important part with proper housekeeping, hand washing, restricted eating, drinking, as we discussed in other health hazards. During transportation, you want to use containers that are sealed, break-proof. Then you want to wipe down containers before and after use. You want to wipe the area after removing the container, and you want to have proper labeling. Dispensing. Use proper PPE, dedicated locations such as kennel or cage, drainage, IV administration, disposal, and cleanup. Waste cleanup, use PPE, proper equipment, and disposal methods such as double bagging. You want to follow spill control procedures and provide medical surveillance. Next, we have cleaning controls, or cleaning chemicals, I'm sorry. Veterinary clinics and hospitals use many different cleaning chemicals, and employees should be aware of the hazards, which may cause irritation, such as skin rashes, upper respiratory tract irritation, and eye irritation. They may be corrosive and cause skin or eye burns. Where possible, review and replace the product with a less hazardous product. You want to follow hazard communication rules for labels, SDSs, and training. You want to ensure proper PPE is available and used as directed. As a reminder, do not mix different cleaning products. Mixing cleaning products that contain bleach and ammonia can cause severe lung damage or death. There are many disinfectants and sterilants used in a veterinary facility. We will just cover a few. One is ethylene oxide. It is a carcinogen and may cause leukemia and other cancers. It can cause spontaneous abortions, genetic damage, nerve damage, peripheral paralysis, muscle weakness, impaired thinking, and memory loss. It is also flammable. OSHA has a specific standard for ethylene oxide with an 8-hour time-weighted average exposure limit of 1 part per million. Has a STEL or excursion limit of 5 parts per million. It's a short-term limit. It has an action level of 0.5 parts per million. Its immediately dangerous life and health level is 800 parts per million. In this standard, it requires that you conduct air sampling or monitoring, and depending on what those air monitoring results are, determines what other elements below that you have to follow. If it's high enough, you would have to have regulated areas, which restrict other personnel and requires respirators. You have engineering controls, written program, respirators and PPE, emergency plans for spills, medical surveillance, and of course, hazard communications, including signs, labeling, and training. And this in itself is a full training session as well to go over all the requirements. And again, a lot of it determines on your exposure levels. Another area is our disinfectant or sterilant is formaldehyde, also found as formalin. It's also used as a preservative or tissue fixation. It is a carcinogen. It is highly irritating to the eyes, nose, and throat. It can cause severe allergic reactions to the skin, eyes, and respiratory tract. Causes asthma-like respiratory problems. Causes itching, skin irritation, and dermatitis, and dermatitic itching. Ingestion can be fatal, and it too is flammable. Once again, OSHA has a specific standard for this as well. It permits an 8-hour time-weighted average exposure of 0.75 parts per million, a short-term exposure limit of 2 parts per million, and an action level of 0.5 parts per million. Its immediately dangerous life and health level is 20 parts per million. Similar to ethylene oxide, but not exactly the same, the standard requires air sampling and monitoring to determine what your exposures are. And depending on what those levels are, determine what other elements below are needed. If it's high enough, you'd have to have regulated and restricted areas, engineering controls, respirators, PPE, hygiene program, housekeeping program, emergency procedures, medical surveillance, hazard communication, and training. Glutaraldehyde is another disinfectant and sterilant. It causes occupational asthma, chronic condition characterized by bronchial hyperresponsiveness. It also causes rhinitis, eye irritation, and tearing, contact allergen and dermatitis, and skin sensitization. Another product is peracetic acid, PAA. It is another disinfectant or sterilant. In its concentrated form, it is corrosive and exposure can cause irreversible damage to skin and eyes. However, when diluted, it sometimes causes eye, nose, and throat and respiratory irritation that usually subsides after exposure ceases. On here, you'll see both glutaraldehyde and peracetic acid. They do not have specific OSHA standards regulations, but they do have other requirements. Glutaraldehyde has no OSHA exposure limit, but has a recommended ACGIH, it's American Conference of Governmental Industrial Hygienists, threshold limit value, or TLV, ceiling of 0.05 parts per million, and it does not have a IDLH established. PAA, or peracetic acid, also does not have an OSHA exposure limit, but has recommended ACGIH TLV short-term exposure limit of 0.4 parts per million and an IDLH of 0.64 parts per million. And we'll talk about some controls that apply to disinfectants, sterilants, such as glutaraldehyde, peracetic acid, as well as all disinfectants. You want to have local exhaust ventilation, control the source of exposure. You want to have general room ventilation to dilute the air. You want transfer procedures. You want to try to utilize automated equipment where possible. Use safety nozzles in all dispensers. Use automated dispensing, disinfecting, washing equipment as applicable or feasible. You want to use mobile disinfecting stations. And you want to look at your facility design to try to reduce areas of exposure. Work practice controls. When transporting and storage, you want to use closed containers and make sure the lids are tight. Have central storage location with spill containment nearby. Additional work practice handling include minimizing splashing using basins or reservoirs. Use safety nozzles. Cover soaking basins. Use a proper size devices such as containers, tools, basins. Keep doors and enclosures on control device. Keep doors and closures control devices closed when in use, and close work area doors. So if it's in a room, close the door to the room. When rinsing instruments, use low flow spray at close range and soak, so you're not splashing contaminant everywhere. Ensure ventilation or drying agent are properly used when available. Do not use or store food, drink, smoke, or apply cosmetics in these areas. Immediately clean up spills. Sometimes respirator may be required if it is required. OSHA also has specific standards for respirators. So if it's required to be worn to protect employees, you must follow these guidelines. When respirators are required by the company based on your policy or OSHA due to exposures, the employer must develop a written program entailing all aspects of the respirator use. A medical approval is required by a physician's licensed healthcare provider. Fit testing is required annually to ensure the tight fit on the respirator, and annual training is required. And initially, it must be done before the employee is exposed to the contaminants. Respirators are used voluntarily, and the employee determines that such respirator use itself does not create a hazard. You must provide employees with the information contained in Appendix D of the respirator standard and is required to establish and implement elements of a respirator program that necessary to ensure that employees using respirator voluntary is medically able to wear the respirator. That means medically approved for the tight fitting respirator. And that the respirator is clean, stored, and maintained so that it does not create other hazards. And if you're only using a filtering face piece or dust mask, then only Appendix D of the standard is required to provide to employees. To clarify on if you're voluntarily wearing a tight-fitting elastomeric or silicone rubber type face piece, they do need medical approval prior to wearing the respirator, even if it is voluntarily. However, fit tests are not required. Another hazard, radiation or X-rays. Most places do have X-rays. You want to have labeling such as that shown in the picture. So you have caution signs in the X-ray areas. You want to do exposure monitoring using dosimetry badges for exposure tracking. You want to make sure appropriate PPE, such as lead gloves or lead shields, are used. You want to develop a written safety and operation instructions. You want to control room temperature and provide appropriate inspection and testing of equipment. Most places have outside sources come in to test for emissions on the equipment itself. Lasers are often found as well. The type typically found are class 4, where in use in veterinary facilities are class 4, where there is immediate skin hazard and eye hazard from exposure to either direct or reflected beam. It may pose a fire hazard as well. Here you see caution signs that should be up. You should post caution signs such as these where the laser are used. You see different signs depending on the power of the laser or application. The notice one means it's being repaired. The general requirements of class 4 lasers should have supervision directly by an individual knowledgeable in laser safety. You should have a restricted area, so you want to keep unauthorized personnel out of the area. When a beam stop of appropriate material must be used to terminate all potentially hazardous beams, and use diffusely reflecting materials near the beam where appropriate. You want to utilize laser eyewear, secure and control beam above or below eye level. The beam path to the laser must be located and secured above or below the eye level for any standing or seating position in the facility. All windows, doorways, open portals, etc., of an enclosed facility should be covered or restricted to reduce escaping laser beams below appropriate ocular MPE level. Place a laser in storage or You want to place the laser in storage or disable the laser when they're not being used. Another hazard is bloodborne pathogens. I mentioned this earlier. The bloodborne pathogens as it applies to human transmission. It applies only to exposure from human blood treating other humans in research laboratories with animals known to be infected with HIV or HBV. So if the only time this applies to animals is in those treatment laboratories where the animals are known to have HIV or HBV. Other animal handling is not covered, such as in veterinary offices. If there may be a chance of exposure and or treatment from human to human, bloodborne pathogens does apply. More than likely, similar to first aid response exposures. So here's what you need to know. You would have to have an exposure control plan. You need to have exposure determination. This means who, what procedures, and to what extent exposure occurs. You want to include compliance methods such as engineering controls. In these cases, mostly items like sharps, containers, whereas in human healthcare facilities, you would see safety needle devices and needle assist safety systems are often used. Include what work practice and policies and procedures you have to control exposures and what PPE is worn for what procedures. Want to have a housekeeping plan in place where cleaning up of blood or infectious materials. You want to have regular cleaning schedules on top of when there's spills and methods of cleaning and decontamination that is used. So the decontaminants that are used, you want to make sure you have EPA approved decontamination. Labeling of contaminated items such as sharps, containers, contaminated waste, and bins. Also, if you have contaminated human exposed laundry, then you will have that labeled as well. You want to make sure that hazard sticker is used. Regarding waste disposal, you want to ensure you follow state and local federal regulations for disposal. You want to have laundry procedures and precautions when handling contaminated laundry. You want to offer hepatitis B vaccinations as appropriate. And you want to have follow-up on exposure incidents and protocol. And you want to train initially and annually. When it comes to first aid and eye wash requirements, they're cross-linked to bloodborne pathogens. First aid responders are required for workplaces who do not have an infirmary, clinic, or hospital or EMS near proximity to the workplace. Adequate first aid supplies must be readily available. And where there are injurious or corrosive materials in the workplace, suitable facilities for quick drenching or flushing the eyes, body shall be provided, within the work area for immediate emergency use in order to be properly maintained so they function properly when they're needed. Exit routes and route maintenance. In order to ensure employees can safely exit the building in emergencies such as a fire, you must maintain exits and exit routes. You must have signage indicating where exits and way of exits are located with directional information as needed. They must be properly illuminated or visible for exit, such as if it's not internally lit, you have to have a light that shines on it so that you can see it, and usually it's reflective material. The exit ways must be properly illuminated, so emergency lighting where needed. Routes must be unobstructed, and door exits must be unobstructed and not locked, and they should typically open in the way of path of travel. Employers must install and maintain an operable employee alarm system that has distinctive signal to warn employees of fire or other emergencies, unless employees can promptly see or smell a fire or other hazard in time to provide adequate warning to them. Emergency action plan is required whenever OSHA standard requires one. Plan must be in writing unless there are 10 or less employees, then it can be oral. It must include procedures on how employees will report the fire or emergency, procedures for emergency evacuation and exit route assignments, procedures to be followed by employees who remain back to operate critical operations if necessary, procedures account for employees after the evacuation, and procedures to be followed by employees performing rescue and medical duties. You want to have the name and job titles of every employee who may be contacted by the employees who need more information about the plan, or an explanation of the duties under the plan. You want to maintain alarm systems. They must use distinctive signal for each purpose. Designate and train employees to assist in the safe and orderly evacuation of other employees, and review the plan with employees initially and when procedures or responsibilities change. Fire protection plan is required whenever OSHA standard requires one. The plan must be in writing unless there are 10 or less employees. Then it can be oral, just like the emergency action plan. It should include a list of major fire hazards, proper handling and storage procedures for hazardous materials, potential ignition sources and their control, and the type of fire protection equipment necessary to control each major hazard. Procedures to control accumulations of flammable and combustible waste materials. Procedures for regular maintenance, safeguards installed on heat-producing equipment to prevent accidental ignition. Name, job titles of employees responsible for maintaining equipment, prevent control of ignition sources. You want to inform employees upon initial assignment to a job of fire hazards to which they're exposed, and a review with each employee those parts of the fire protection plan necessary for self-protection. Other hazards you may find. Depending on the size and capacity, barking dogs and other animal noises may contribute to noise levels exceeding OSHA's action level of 85 decibels for an 8-hour time-weighted average. You would know this by doing some dosimetry monitoring. Lifting animals, equipment, and supplies at ergonomic stressors, which is when assisted lifting, lift tables, and other sorts reduce exposures. Electrical equipment is found in all facilities and must be properly installed and maintained. The workplace may have slippery or uneven working surfaces. You might want to protect against that or put precautionary measures up. In addition to all the other record keeping described, employers need to make employees aware of exposures and medical monitoring records and their availability and maintain these records for 30 years. That concludes our presentation today. Here you'll see our website's homepage. We highly advise visiting it. There is a lot of information, including off to the left. You can see our newsletter. You can make a request for services, view past webinars, view OSHA videos, VTools. Let's see here. Oh, this is, I apologize. See off to the left here, there's a lot of information, including resources, previous webinars, focal points, which are a short video series of compliance topics. You can sign up for a newsletter or to our YouTube channel. You can see how the consultation process works. There's also a link for our partner, the PA Department of Labor Bureau of Workers' Compensation, where they maintain the PATHS program. That's PA Training for Health and Safety. They have over 200 free training topics. You can become a Pennsylvania Certified Safety Committee, where you become certified. You obtain a 5% reduction in workers' compensation premium. Mentioned you can request our services. You can view past webinars. And I think it's pretty much everything on that page. On this page, you can use the link just mentioned on the previous slide, or you can use this address up here to the YouTube channel and subscribe to the YouTube. Again, here's our contact information from me, the office, our website, Facebook, and Twitter. You can use those addresses there. Thank you for joining our webinar. Our next webinar is respiratory hazards in the cannabis industry and is scheduled for March. Thank you again for attending, and goodbye.